Rising cost and shrinking margins are big challenges in the healthcare business world. And the usual response is cost cutting or compromising quality. But Cone Health showed there is a third option too. Within just 12 months, Cone Health delivered a $100 million financial turnaround without layoffs, without cutting quality, and without losing their workforce. Welcome to HealtheNomics. I am Dr. Ayoub Ashraf. I work in healthcare strategy and execution. In this series, we examine real success stories from leading health systems, how executives are solving complex challenges around equity, access, cost, and quality. I believe that keeping patients healthy and out of the hospitals is not only possible, it is actually profitable. Let's learn what actually works. I want to clarify one thing upfront. I have no financial, professional, or advisory relationship with Cone Health. This discussion is purely based on what was publicly shared as a case study. This case was shared at the American College of Healthcare Executives Congress 2025 by Senior Vice President and Chief Nursing Officer at Cone Health, Vian Antrim, and Senior Vice President for Ambulatory and Customer Services, Dino Adkin. This is not a motivational story. This is a playbook that healthcare leaders can learn from. Now, let's talk about the strategic problem. Cone Health is an integrated health system based in North Carolina, serving largely a regional and community based population. It operates in a highly cost sensitive market with a payer mix that includes significant population of Medicare, Medicaid, and uninsured patients. That makes financial discipline not optional but essential for their survival. Like many systems after the pandemic, they were facing margin compression, workforce strain, and rising supply cost. Clinical quality was good, but financially the trajectory was not sustainable. As part of their strategic planning, they identified problems that are actually very common across the health systems. Departments were operating in silos, goals were shifting from quarter to quarter, and managers were reacting instead of leading. So, leadership realized something important, that survival was not going to come from expense reduction alone, but execution had to become as predictable as clinical protocol. Like when you do X and Y, there should be higher probability of getting Z as a result. So instead of launching a traditional cost cutting initiative, they focused on building an execution system. They called it Fueling Our Future. And the goal was clear, to deliver $100 million in operational improvement within one single fiscal year. Now, the important part is how they operationalize the goal. They created a 12-month strategic calendar and broke the year into four phases. Phase one was infrastructure and target setting. Phase two was tactical execution. Phase three focused on barrier removal. And phase four was momentum capture and finishing strong. They established a senior leadership council called SLC, which was chaired by the CEO and COO. This group met every 2 weeks to review the progress. Each senior leader owned a system wide work stream such as staffing, patient flow, or utilization. Ownership structure was very clear, and then they formed divisional scorecard action teams, which were called DSATs. These reviewed leading indicators every week instead of months to wait and report. Leaders were looking at very practical operational signals like contract labor usage, unit level productivity, length of the stay variation, operating room utilization, patient access metrics, patient flow bottlenecks, and supply usage trends. And when a metric moved in wrong direction, the conversation was not why did this happen last quarter? The question was, what decision are we taking this week to fix it? This shift from reporting to decision making is what changed execution to whole new level. They also introduced something called Strong Finish Fridays. These were short updates where teams shared wins, obstacles, and next steps. It created transparency, it created accountability, and it created momentum. Another subtle but powerful change was behavioral discipline. Once priorities were set, they were not allowed to change every quarter. Side projects were intentionally paused, and leaders could not escalate everything as urgent. They were expected to remove barriers, not to add noise. That stability gave managers the confidence to execute instead of constantly reacting to different scenarios. So, what did this discipline produce? By the end of fiscal year, Cone Health exceeded its $100 million target. They did so without reducing headcount, without compromising quality, and without damaging patient satisfaction. Yes, there was a financial win, but the biggest achievement was cultural change, a changed perspective, and a changed mindset. Leaders shifted their attitude from reacting to problem solving to owning execution. Frontline teams gained confidence and predictability instead of fatigue. This became less about saving money, but more about learning how to deliver results together. The lessons for other leaders is simple. Transformation does not happen through one big idea. It happens through disciplined execution, reviewed in real time. Conehealth's turnaround was not a financial fluke, it was a leadership process that turned strategy into the results. When every leader owns outcomes and performance is reviewed in real time, results become inevitable. Cone Health reminds us that success is not about doing more. It is about doing what matters the most with consistency and then repeating the process. If you are leading a health system today, then ask yourself this question. Does your organization has a predictable execution cadence? If yes, it's good. But if not, then this model shows that financial and cultural change is absolutely possible. Thank you so much.